Coding basics, why do we use codes? And then this is designed to be a basic one. I see some people in the audience with a little more gray hair than I have and not quite as much as I have, or in some instances none. But this is more of a basic coding lecture. So we use codes to tell the insurance companies what we did and why we did it, and anything special about what we did and why we did it. So we use the codes. We have CPT, the ICD-10, and HCPCS codes. CPT stands for Current Procedural Terminology. I am the CPT advisor for APMA, so I'm at the CPT meetings. We meet 3 times a year to develop new codes, refine old codes, change terminologies, things like that. Keep in mind the AMA owns CPT, so they have a vested interest in CPT. So anytime you buy and CPT book, AMA is getting a royalty on it. Category 1 codes are the codes we typically use. Those are like the Bunyan codes, the 2829 series of codes. Category 3 codes are experimental and investigational codes. So if you do a subtalar joint arthroresis procedure, that's a Category 3 code. Codes are added, deleted, updated 3 times a year. They become effective on January 1st. So the book that you get, or an APMA Coding Resource Center, if you look at that, it's updated, so it's good to go on January 1st with all the new codes that are in it. Category 1 codes are always numeric. Category 3 codes are alphanumeric, and HCPCS, a Healthcare Common Procedural Coding System, are alphanumeric codes too, and those we'll talk about those a little bit later. They're the codes that have the DME aspects, skin substitute, products, things along those lines are in the HCPCS codes. ICD-10 is the 10th edition of the International Classification of Diseases. The first one was in like 1880, and we're now in the 10th edition. 11 is being used in other parts of the world. When we were introducing ICD-10 at a CPT meeting about 8 or 9 years ago, God bless his soul, Harry Goldsmith got up at the meeting and said, the rest of the world's going to ICD-11. Why don't we go to ICD-11 from ICD-9? And the answer from the head of CMS was, well, we can't count 9, 11. We have to go to 10. That was the answer. But when we do go to 11 eventually, it's not that much different than 10. So not the massive change we had from 9 to 10. It's not that much difference from 10 to 11. Not who owns ICD, the World Health Organization owns ICD. AMA does not own it, but in the United States, CDC is the organization that oversees ICD in the United States. ICD-10 codes are alphanumeric, and we'll talk about the structure of those codes. We won't go through specific codes, but we'll talk about how the structure is and help you understand how detailed you have to be. On the structure, the first 3 characters describe the body system, what you're looking at. So the first character is always going to be a letter, so A through Z. Second character is always going to be a number. Third character is always going to be a number. Then there's a period. Okay, so it would be like B7 to point something. So the example I'm using is just a general pain. M79 is the ICD diagnosis for pain. I haven't really told you anything. I've just said we've got pain somewhere. Okay, so we have to go further. So we have to go to the 4th character. It defines the site, etiology, manifestation, or state of the disease or condition. It's always numeric. So the 4th code, M79.6. So we've said we've got pain in a limb, hand, foot, fingers, or toes. Okay, so we've eliminated the head and the central part of the body. So we're isolating it down to where it is. If you go to the 5th character, it becomes more specific. And we said we've M79.60, pain in limb. Well, now I've gone from the entire body to one of 4 places. So we still haven't said where exactly we're talking about. I've got a limb somewhere. And if you go to the next character, to the 6th character, we've said M79.601, I've got pain in the right arm. Okay? 03 would be pain in the right leg. Okay? So you're getting more specific with each one. There's some caveats to it. There's some so-called character extensions. These are typically letters, not always, but usually letters, and they're typically in the 7th place, in the 7th character. they're non-fracture character codes. If you've got injuries or something like that, you would go to a 7th character that says this is initial time I've seen the person for this injury. Maybe it was a laceration. First time I've seen this patient for this injury. Subsequent encounter. And then the last one is the sequelae. So if you've got somebody that's got a laceration and it's all treated and they come back 2 years later and they've got nerve damage from that laceration, that's a sequelae from the laceration, in addition to the nerve damage code. There are also fracture care codes, and these are the ones that we'll specifically use more frequently. If a patient comes in with a 5th metatarsal fracture, you can use the diagnosis as 5th metatarsal fracture, and then for the 7th character, it's the first time you've seen him for this, so it's going to be A on the initial character. So that 7th character will be an A. And you have to carry it out to that 7th character, or else the insurance company is going to deny the claim. If it's an open fracture, that 7th character would be a B. It's the difference between closed and open. Subsequent encounter for a normal healing fracture, you're seeing the patient, everything's going fine. This is the 3rd or 4th follow-up that you're seeing the patient, and everything's healing fine. Your diagnosis code changes from that A to D, saying everything's healing fine. Or if they're not healing fine, it would go to delayed healing, non-union, malunion, one of those. Rarely we're going to use the S, the sequelae, for this one because typically you're just not going to see those down the road. So you don't really have to worry about the S. So the ones you're typically going to use are either A, B, or D, if everything's healing well. So if you're going to go back in, the patient's got that 5th met fracture and it's just not healing, 3 months down the road, you're going to go back, take them in the operating room and do an ORIF on that 5th met fracture. Then you're going to change to non-healing or delayed healing or non-union or malunion, something like that. 7th care example, lacerated right ulnar artery. That's just an example of how to go out to the 7th character. Okay, so questions with the structure of ICD. Again, we're not going to talk about specific ICD codes. They're in the books. You can find them. But that's how you structure, that's how you look for the structure and how far you have to go. If you see on the Coding Resource Center, if you see a code that has a hyphen after it, an ICD-10 code that has a hyphen after it, that means you're not done. You have to go to the next space. If there's a hyphen there, you have to go to the next one. So frequently, it'd have to go all the way out to 7, but not always do we have to go to 7 characters. If you think about onychomycosis, that's only a 3-digit character.